In-office verification of rigid gas permeable lenses is one of the most important steps in successfully fitting RGPs. It enables the contact lens practitioner to ensure that lens specifications ordered have been fulfilled. This program features RGP verification procedures. These techniques are easily acquired through practice and can give you optimum control over the lens quality, lens fit, and patient comfort. RGP verification is important prior to dispensing, periodically during follow-up care, and after symptoms related to lens defects are reported. The variety of lens materials available today makes it difficult to determine by case history alone which type a patient has been wearing. Use of a specific gravity kit is the first step in verifying lens material. The lens is placed in a series of solutions, having a progressively higher specific gravity. Identification is possible when the lens sinks in a particular solution. Contact lens power is verified with a lensometer in much the same manner as measuring spectacles. The back vertex power, measured in diopters, can be determined by centering the concave side of the contact against the lens stop. Practitioners and labs generally refer to back vertex power, since phoropters, corrective curve trial lenses, and spectacle lenses are referenced in this way. When measuring, notice the reticle can be brought into focus evenly. This indicates the lens is a single power or a spherical lens. The power is the same in all meridians. In our example, the spherical contact lens is measured to be -1.5 diopters. With a toric contact lens, the reticle lines 90 degrees apart must be brought into focus separately. This indicates the lens has two different powers. This toric contact lens is measured to be +3/4 of a diopter in one meridian and -4 diopters 90 degrees away. With a prism ballasted bifocal lens, be extra careful about centering the lens on the stop. The prism power can be determined by the amount of decentration of the target in relation to the center of the reticle. Each ring corresponds to one prism diopter. In our example, the amount is 1 prism diopter. The base curve radius of a rigid gas permeable contact lens can be best determined by using a radioscope. This measurement is the most crucial parameter to verify since it relates directly to the lens to cornea fitting relationship. RGP lenses should be soaked 24 hours prior to verification, as the material may flatten upon hydration. Soaking also enhances lens surface wettability. Measuring a spherical lens, notice the reticle or spoke pattern can be brought into focus evenly. This indicates a single base curve or a spherical lens. If a degraded spoke pattern is observed while measuring the base curve radius, it may be attributed to a dry lens well. This is easily resolved by adding water to the radioscope lens mount. A dirty lens. Proper cleaning will significantly improve the image. A warped lens also results in a degraded image. The reticle lines, 90 degrees apart, must be brought into focus separately. This indicates the warped lens has two different curves on the surface. Patients who suddenly complain of decreased wearing time, poor vision, or take a spherocylindrical overrefraction may be experiencing either a warped lens or lens flexure. A lens that exhibits flexure will not show a degraded radioscope image. Toric lens base curves are verified much like a warped lens. However, a toric lens is intentionally designed with two different curves. It generally has a much greater dioptric difference between the curves than a warped lens. Verification of the lens design parameters is especially important prior to evaluating the fitting characteristics of a given lens. Overall diameter is easily determined by using a 7 or 10 power handheld measuring magnifier. The lens is held concave side down on the back surface of the magnifier with a light source in the background. Line up the lens against the zero edge of the scale. This lens has an overall diameter of 9 millimeters. The optical zone diameter is 8 millimeters. The lens should be rotated 90 degrees to check for possibility of an oval optical zone. Other methods of verifying the overall diameter of an RGP lens include The use of a projection magnifier, where the structural and surface qualities of a lens are easily verified. The projected shadow image of the lens can be measured off the scale. A slot gauge can also be used to determine overall diameter. The lens is placed in the channel and gently positioned to fit where the channel narrows to match the lens dimension. A diameter of 9 millimeters is read at the midpoint of the lens. Be careful not to force the lens down the channel, as the edges might be damaged or the diameter may read incorrectly. A tolerance of plus or minus 0.05 of a millimeter difference between the diameter ordered and received is acceptable. The peripheral curve, or PC system of a lens, helps in overall lens alignment, debris removal, and tear exchange. A measuring magnifier can be used to measure the curve widths. The peripheral curve width of this lens is 0.5 millimeters. Let's look at a lens without a PC system. Evaluation with a projection magnifier reveals a monocurve or single curve lens with no junctions or light reflex changes across the surface. With a bicurve lens design, note distinct light reflex changes at the junction between the base and secondary curve. For a tricurve, the light reflex changes at the sharp junctions between the base, secondary, and peripheral curves. A blend is applied to a lens to reduce the sharpness of the junctions between the base curve, secondary, and peripheral curves. Projection magnifier evaluation reveals an unblended tricurve. The light reflex changes at the sharp junctions between the base, secondary, and peripheral curves. Blending enhances tear exchange, debris removal, and patient comfort. A light blend is achieved after a few seconds using a blending tool during the modification process. The transition zones are still easily observable. Blending smooths the curved junctions. About 10 seconds are required for a medium blend. The curved junctions are less distinct. After 20 seconds, a heavy blend blurs, but does not totally remove the transition zone. Lens center thickness is most frequently measured by a dial gauge. The value is measured in millimeters. This lens is 0.2 millimeters thick. If measured value is greater than desired, the lens may decenter on the eye and decrease oxygen transmission. If thickness is less than desired, lens flexure may result. By repositioning the lens, edge thickness can also be measured. The shape and quality of an edge is important for providing the patient with a comfortable and well-centered fit. Edge inspection is possible with a number of instruments, including the biomicroscope. A projection magnifier is also used for precise evaluation. The edge should be observed frontally and in profile. A good edge presents a smooth, rounded tip with a centered apex. A sharp edge has a pointed tip. Polishing smooths and rounds the apex. A frayed edge can also be smoothed and tapered by polishing. If large microchips are present, discard the lens and reorder. A blunt edge must be reshaped first, then polished. The Edge Profile Analyzer, used in combination with the radioscope, also allows for direct inspection of any contact lens edge profile. In review, RGP verification is essential prior to dispensing, periodically during follow-up care, and after symptoms related to lens defects are reported. Recommended equipment for RGP verification include a specific gravity kit, lensometer, radioscope, projection magnifier, handheld measuring magnifier, slot gauge, dial gauge, and edge profile analyzer. In-office verification of rigid gas permeable lenses may be the most important step in successfully fitting RGPs. These techniques are easily acquired through practice and can give you optimum control over the lens quality, lens fit, and patient comfort.